Let's talk more about the acetabulum. It's located on the pelvis and it forms the socket portion of the hip joint. It's where the femoral head, the ball of the hip joint, articulates, allowing for the wide range of hip movements. The acetabulum is a concave, cup-shaped structure composed of three bones in the pelvis: the ilium, the ischium, and the pubis. These three bones come together and fuse during development to form the acetabulum. The cup shape allows the head of femur to fit snugly within it. The inner surface of the acetabulum is covered with articular cartilage, a smooth, slippery tissue that reduces friction between the bones. This cartilage allows for smooth and pain-free movement of the hip joint. The lunate surface of the acetabulum is the articular surface of the acetabulum, which makes contact with the head of femur as part of the hip joint. It forms an incomplete ring that is deficient inferiorly, opposite the acetabular notch. The lunate surface surrounds the central non-articular depression, the acetabular fossa, which does not make contact with the femoral head in the articulated hip joint. Surrounding the acetabulum, there is fiber cartilage ring called the acetabular labrum. This structure adds stability to the hip joint by deepening the acetabular socket and providing additional support for the femoral head. The ligament of the femoral head, also known as the ligamentum teres, is a ligament located in the hip joint. It connects the femoral head, the ball of the ball and socket joint, to the acetabular notch, a small depression in the hip socket. The ligament of the femoral head is a small structure and does not play a significant role in providing stability to the hip joint like some of the other ligaments in the area. Instead, it mainly serves as a channel for small blood vessels that supplies blood to that portion of the femoral head. Now, the acetabulum, along with the femoral head, allows for a wide range of movement in the hip joint, including flexion, extension, abduction, adduction, and rotation. It provides stability to the joint and it bears the body's weight during activities like walking, running, and standing.